So we saw people rating the seriousness of different behaviours that we looked at inevitably quite differently. There was a lot of diversity across the practitioners that we spoke to and the members of the public. But there are still some pretty clear patterns there. So however people were rating them, we tend to see the same relative positions. And I think two themes that came out in the findings that we had in this research in terms of what tends to make behaviour more serious is, well, the first thing is if it is physical behaviour. So things that involve some kind of physical contact or physical touching were tended to be seen as more serious. And that may actually be, I'm not sure, but it may be a special case of the second pattern, I suspect, which is when behaviour was more intrusive. So for instance, asking somebody questions about their sex life is seen generally as being worse than talking about your own, because it's a bit intrusive. I'm kind of invading your space. Social media was another thing, posting things on social media. That's going beyond the immediate interaction that we have, and it's intruding into your life because other people are going to see it, friends are going to see it, relatives are going to see it, those sorts of things. And intrusion was a really critical issue here. And I think behind that, there's something about the extent to which something is happening to you that you can't control. So when it's physical, when it's intrusive, I'm losing now control of the situation. Two types of argument, two broad classes of arguments were advanced by people. Now the first of those arguments is that perhaps this behaviour does have a direct impact on public confidence or on quality of care. So for the first of those, for the public confidence, obviously if it's witnessed or heard about by patients, then it could have a serious impact in that respect. On quality of care, one of the arguments that was developed by practitioners was say we have to look at what this does to the practice, the performance of the person who's on the receiving end of this unwanted behaviour. If it's making them uncomfortable, stressed, if it's making this a difficult working environment, then they may be compromised in terms of what they're doing. It could also have a broader impact on the broader team. So that's the impact type of argument. But perhaps more interestingly, a second kind of argument that was developed was around risk. And what the structure of this argument is, this behaviour, if this behaviour tells me something about the character of the person that's doing it, it tells me something about perhaps a flaw in their character. So what risks does that flaw create when they're now interacting with patients? So what does that then going to mean for quality confidence and those sorts of things? So yeah, I'm seeing their character evidenced here in their interactions with a colleague, but it's the same person who is then interacting with patients. Two kinds of flaw were identified as being really important here. This is our structure on it, but we could see these two types of flaw. So the first is what we've called motivational flaws, and that is that this behaviour is evidence that there's something a bit wrong with the motivations of this person. And in particular, those motivations are not really the kinds of things that you would expect from a healthcare professional. They are perhaps not quite able to control some of their impulses, or they seem to be lacking that caring motivation, which is so fundamental to anyone working in health and care. The second kind of flaw is a flaw, and we put a flaw in understanding. So this is about people lacking critical qualities that are essential to having a successful interaction with a patient. And two stand out here. I mean, the first one is empathy. If I'm able to do these things to you as a colleague, and I don't notice the impact that it's having on it, I can't pick up on the fact that it's making you uncomfortable, then what does that say about my ability to pick up on those things? And now when I'm in interactions with patients, when it is critically important that I have that empathy, I can see what is happening. Well, if I lack that quality, that's a real problem. The second is a lack of judgment. Okay, if I am misjudging and thinking that this is appropriate, then my moral compass, as one participant put it, is a little bit screwy. There's something slightly wrong here. And again, if my moral compass is wrong in that setting, then that's going to create issues. Potentially there's a risk in a patient setting. So a couple of participants talked about consent, for example. If I'm not able to understand that this person isn't giving me consent and I can't work through the ways in which that should therefore shape my behaviour, then when I move into an interaction with a patient where those qualities and abilities are critical, we've got serious risks. I think the short answer, I'm going to jump straight to the short answer, is no. So let's look though at why it isn't a mitigating factor for the participants we spoke to, and what role it does play, because it is a significant thing and it is real. So let's start by saying that quite a few of our participants, and especially the practitioner participants, though the public participants also acknowledge this as well, they talked about the importance of being able to have friendly relations and sometimes friendly banter in the workplace context. And let's remember that for many healthcare professionals, we're talking about people who have to work very long hours in these teams, highly stressful environments, with very, very emotional and difficult situations. And also for some of them, the topics that they deal with may be inherently sexual. And a few of them talked about the inappropriate behaviour that they have to manage and deal with from patients. So there's an awful lot of stuff that people are dealing with. And people talked about the way that when you're with these colleagues that you may be spending more time with than you spend with your friends and family, you have to develop friendly relationships. If you're rigid, if you're fixed, if you're having to follow rules all the time, it's not going to be possible to operate as a human being in those settings. So there is a role for some flexibility. What I talked about earlier is the relationship protocol for developing our own norms of how we work together. And that can, of course, spread to a team. If you have a team that works together, then we as a team may develop shared standards about the sorts of things that are appropriate here, the kinds of risque jokes that we can tell, the kind of comments that get made, etc., etc. But what happens if perhaps we have that sort of acceptance, but then somebody is not comfortable with it? People were really clear. If somebody's not comfortable with it, then the norm isn't shared. We can't appeal to a shared norm if it's not shared by that person. I can't say, well, it's okay for me to behave in that way to that person because other people are happy with it. What matters is what that person thinks. So it isn't a legitimating factor. What it can do is it might make it more plausible that a particular instance can be seen as an error rather than a fundamental flaw in a person's character. And let me just give you an example of that. People talked about instances where someone new comes into a team. They see behaviour, perhaps between a couple of the team members, and they think, oh, that's acceptable. It's acceptable to tell jokes like that round here. And they behave in that way to another person. They haven't realised that it was the relationship between those two people and not the team culture. And they get it wrong and they cause offence. And then people talked about saying, well, in those instances, it's a mistake. We have to address it. It's wrong. It needs to be addressed. But it's, they made a bit of a poor judgment, but it's not like we've really thrown up a critical challenge in their behaviour unless they keep repeatedly doing it. Okay, so culture can lead you to believe that something was an error rather than a flaw, but it doesn't make the behaviour acceptable. We talk a little bit in the report about the challenges that leaders and managers face, and I think employers face similar challenges. The issue is that workplace banter was identified by a number of the participants and recognised by members of the public as well as having positive benefits. We're talking about human beings who are operating in really stressful settings, working long hours together, and often having to deal with strong emotions and distressing situations, all of the things that we can talk about here. And participants talked about the way in which what one participant described as those 4 o'clock in the morning conversations, how those can be an important part of what keeps you going. They're an important part of your support structure. So a rigid zero tolerance approach risks inflexibly applying that standards protocol and not leaving room for the relationship protocol where it may have value. The flip side of that is as soon as you allow those more flexible spaces, you are creating risks. You're creating risks that people won't feel able to say when they're not comfortable with behaviour, that consent is assumed when it isn't present, that differences in seniority and power will perhaps inadvertently be exploited. So I'm as your manager, I'm telling these jokes and you're not comfortable with them, but you don't feel able to say something. So there are serious risks there. And I think one of the things the research would suggest that rather than taking a zero tolerance approach to that kind of banter, it might be more important to focus on really ensuring that consent can be withheld. And that is the critical thing here, that people have the option, a real opportunity, one that they can use and feel empowered to use, to say, I'm not comfortable with this, and that's respected. And that may be perhaps a better way of retaining some of the benefits than simply drawing a hard line.